Hi everyone, I hope you're doing well. This is the second video where we're still focusing on the basic counseling skills. So let's start looking at what we'll be covering today. In this video, we'll focus on interviewing practices. One of the most important aspects of working as a psychologist or a counselor is a psychological interview. During an interview, you should be able to collect information from interviewees efficiently so you can develop a therapeutic alliance, which is where we mentioned this many times throughout this unit, but therapeutic alliance is the cornerstone of effective psychological intervention. So let's listen to the following podcast to understand the interviewing process a little bit better.
Welcome to another RMIT online podcast. This is Dr. Kirsten Abbott, clinical psychologist and associate lecturer at UNSW, and I'm here with Katrina Norris, psychotherapist and clinical psychologist, to talk to you about applying reflection in practice. Katrina, what is psychological interviewing?
It's essentially the interview that we use to understand the individual that we're working with, or it could be a group of individuals that we're working with. So it's the process of identifying background in terms of psychological and social history, educational history, childhood development. If you're working with an individual in a clinical setting, it's also the process of understanding current concerns or current issues around symptoms and functioning. And then identifying things such as the goals for treatment or what the client or the individual is hoping to get out of seeing the psychologist. When working with groups or in settings outside of clinical where you use a psychological interview, it is similar. It's essentially information gathering around the background for working with the individual or groups. It's the issues at hand or the concerns that are of importance and identifying the goals and the processes for moving forward.
And that's a great response. And how do you use psychological interviewing in your role currently?
So I use psychological interviewing almost every day in my role, whether it's working with my clients who have been injured in the workplace and are looking at return to work services, or whether it's working with clients who are coming to me for mental health treatment. I'm using the psychological interview when I'm first meeting with them. And in those first meetings, it's to better understand what their needs are, to identify factors that might be contributing to the problems that they're experiencing or factors that can contribute to moving forward in their recovery. And it's working with them to identify the goals that they have for the services that I'm providing to them and where they see themselves at the end of me providing those services to them.
What would you say are the most important skills to have when conducting psychological interviews, and how do you use those skills?
The first one really is the skill of rapport building, and that's one that gets developed over time with practice, with working with people more and more and getting comfortable in your practice, but essentially it's around demonstrating empathy, authenticity, unconditional positive regard, so being non-judgmental and showing care and warmth. Active listening goes into that as well in terms of being able to reflect back to people what you're hearing, showing understanding or clarifying things when you are unsure as to what they're doing. And that helps to build that rapport and build confidence between you and the individual that you're working with. Questioning is another one that is essential in terms of the psychological interview. So starting quite open, allowing people to tell their story as comfortable as they are with that, and then narrowing questioning down when you need to be able to draw out more specific information and help people understand what you're needing of them to be able to support them better. And I think another essential skill is flexibility, adaptability, and presence. Being aware of your environment and the environment you're in with the individual, being aware of how they're feeling in that environment and what they're reflecting back to you, and adapting your approach to them to meet their needs and meet the energy that they're coming with as well. So that involves being really present in the room with them. If you're working with a group, it's being present in the room with the group and being able to identify the competing needs of people that are in a room and responding to those accordingly so that you're really building that rapport with everyone and everyone is feeling comfortable in disclosing information.
Katrina, I mean, it's really hard to start to develop psychological interviewing skills. Based on your experience, how can psychology graduates begin that journey of developing these skills?
It comes with practice. Some people are really great at rapport building and really great at getting along with other people and getting them to open up, and that's their natural personality. But for a lot of us, it's not as natural. So it comes with practice. It comes with your supervision and your placements that you do through university and getting feedback from other psychologists. It also comes with building your confidence. So the more you do it, the more you're interacting with people, the better these skills get. The other side of it is reflective practice. So looking back at what you are doing, reflecting on your strengths, what you feel you've done really well, but also looking at the areas where you think maybe you were limited or maybe you struggled, and identifying ways to build that up through professional development, courses, doing courses on communication skills, on conflict resolution, on active listening. All of those can be really great ways to build up your psychological interviewing skills when you do recognize that maybe it doesn't come as naturally to you.
This concludes another RMIT Online podcast. Thanks, Katrina, for participating, and thank you for listening.
That was a really interesting podcast. I always appreciate the conversations between Dr. Kirsten Abbott and Mary Goslet because they elicit so many relevant information, particularly in this case about the interviewing practices. So let's talk a little bit more about the clinical interview. The clinical interview is a really important process that health professionals learn and apply throughout their careers. As a process, the clinical interview functions as an assessment, for example, neurological or forensic examinations, or signals the initiation of counseling or psychotherapy, and that can include formal or informal assessments. So we never really talked a lot about formal or informal assessments, but basically a formal assessment would be something like, for example, cognitive assessment, IQ. On the other hand, an informal assessment would be the clinician or the counselor, in our case, trying to ascertain some information in order to do what we call case formulation. So again, we haven't talked about case formulation yet, but this is just to give you an idea of what are the differences between formal and informal assessment. The clinical interviewing is dynamic and flexible. Every interview is a unique interpersonal interaction with interviewees integrating cultural awareness, knowledge, and skills as needed. It is difficult to imagine how clinicians could begin treatment without an initial clinical interview. In fact, clinicians who do not have competence in using clinical interviewing as a means to initiate and inform treatment perhaps may be considered slightly unethical. And here we've got a nice definition of clinical interviewing. And it says, a complex and multidimensional interpersonal process that occurs between a professional service provider and a client. The primary goals are assessment and helping. To achieve these goals, individual clinicians may emphasize structured diagnostic questioning, spontaneous and collaborative talking and listening, or both. Clinicians use information obtained in an initial clinical interview to develop a therapeutic relationship, case formulation, and a treatment plan. All clinical interviews follow a common process or outline, and in fact some scholars suggested that there should be a generic model outlining 5 stages, and the stages are introduction, opening, body, closing, and termination. Each of these stages includes specific relational and technical tasks that will be discussed in the coming slides. Let's start by looking at introduction. The introduction stage begins at first contact. An introduction can occur via telephone, online, or when prospective clients read information about the therapies. It could be online description or informed consents and things like that. We also need to think about the client expectations, the role induction, first impression, and initial rapport building within this interviewing stage. So client expectations means addressing what the counselor will expect and what the client can expect out of the therapeutic process. Role induction means outlining what would be the role of whoever is conducting the interview, whether that's a clinician or a counselor. Now, first impressions, whether developed through informed consent paperwork or initial greetings, can exert powerful influences on interview process and clinical outcomes. Mental health professionals who engage in ways that are respectful and culturally sensitive are likely to facilitate trust and collaboration, and this will result in more reliable and valid assessment data. Technical strategies include authentic opening statements that invite collaborations. For example, the clinician might say something like, "I'm looking forward to getting to know you better," or "I hope you'll feel comfortable asking me whatever questions you'd like to ask together today." Using friendliness and small talk can be especially important to connecting with diverse clients. The introduction stage also includes discussions of confidentiality, therapy's theoretical orientation, and role induction. So once more, the idea of role induction, it could be something like, "Today I'll be doing a diagnostic interview with you. That means I'll be asking lots of questions. My goal is to better understand what is troubling you." So that's a little bit of the description of the role. That is why we say role induction. In terms of confidentiality, we can talk a little bit about what does confidentiality mean in the counseling context. And the theoretical orientation that the therapist adopts, that usually comes in more advanced stages of our professional development. That's when counselors or psychologists directly adopt a specific inclination. For example, it could be psychoanalytically oriented, it could be person-centered or humanistic oriented, it could be a range of things. Now let's move on to the opening stage. The opening provides an initial focus. Most mental health practitioners begin clinical assessments by asking something like, "What concerns bring you to counseling today?" This question guides clients towards describing their presenting problem, and psychiatrists refer to this as the chief complaint. Clinicians should be aware that opening with questions that are more social, for example something like, "How are you today?" or "How was your week?" prompts clients in ways that can unintentionally facilitate a less focused or more rambling opening stage. Similarly, beginning with direct questioning before establishing rapport can elicit a little bit of defensiveness from the client. Many contemporary therapists prefer opening statements or questions with positive wording. For example, rather than asking about problems, therapists may ask about goals. Something like, "What are your goals for our meeting today?" When focusing on diagnostic assessments and using a structured or semi-structured interview protocol, the formal opening statement may be scripted or geared toward obtaining an overview of potential psychiatric symptoms. For example, something like, "Does anyone in your family have a history of mental health problems?" And this type of questions will help the clinician or the counselor guide this interviewing process a little bit better. Now moving on to the body. The purpose of the interview dictates what happens during the body stage. If the purpose is to collect information about psychiatric diagnosis, the body includes diagnostic focused questions. Alternatively, if the purpose is to initiate psychotherapy, the focus could quickly turn towards a history of the problems and what specific behaviors, people and experiences clients have found more or less helpful. Now, when the interview purpose is assessment, The body stage focuses on information gathering. Clinicians actively question clients about distressing symptoms, including the frequency, duration, intensity, and quality. During structured interviews, specific question protocols are followed. These protocols are designed to help clinicians to stay focused and systematically collect reliable and valid assessment data. Now moving on to the closing stage. As the interview progresses, it is a clinician's responsibility to organize and close the session in ways that assure there is adequate time to accomplish the primary interview goals. Tasks and activities linked to the closing include providing support and reassurance for clients, returning to role induction and client expectations, summarizing crucial themes and issues, providing an early case formulation or mental disorder diagnosis, instilling hope, and as needed, focusing on future homework, future sessions, and scheduling. And finally, looking at the last stage, and that is termination. Termination involves ending the session and parting ways. The termination stage requires excellent time management skills, but it also requires intentional sensitivity and responsiveness to how clients might react to endings in general, or leaving therapy office in particular. Dealing with termination can be challenging. Often, at the end of an initial session, clinicians will not have enough information to establish a diagnosis. When diagnostic uncertainty exists, clinicians may need to continue gathering information about client symptoms during a second or third session. Including collateral information to triangulate diagnostic information may be useful or necessary. And that's all we wanted to share in relation to the clinical interview. Now, keep in mind that the language we're using here, clinical interview, denotes that this may be performed by a psychiatrist or a clinical psychologist, and perhaps this unit particularly focus more around counseling. So when we talk about diagnosis, keep in mind that a counselor will most likely not diagnose, may have a hypothesis, may have an identification of what the issues are, but it doesn't necessarily align with a specific psychiatric diagnostic. So that's something for you to keep in mind. Hopefully you got a lot out of what a clinical interview looks like, or in your case, an initial interview in counseling context look like. Hopefully you get to practice a little bit of these in your live tutorials, and we'll see you in the next video.